Welcome to the deep dive. Today, we're getting into something pretty interesting, maybe a bit puzzling, in cat health. Feline Eosinophilic Keratitis. You probably know it as FEK.
That's right.
And look, you're here because you want to get a good handle on this condition quickly, right?
Yeah.
Without wading through tons of dense text.
Exactly.
So that's our goal. We've pulled together some detailed info on FEK, and, well, our mission is to really pull out the key stuff, which you absolutely need to know, but keep it understandable.
Yeah, cut through the jargon.
Exactly. And maybe expect a few surprises as we dig into this unusual eye thing in cats.
Okay, let's dive in then. So feline eosinophilic keratitis, FEK. Fundamentally, it's an inflammation of the cornea, that clear front part of the eye.
Window is the eye, basically.
Right. And what's really key here is that it's thought to be immune-mediated.
Meaning the cat's own immune system is involved?
Precisely. It's like the body's defenses get a bit confused,
Yeah.
And they start causing inflammation right there in the eye.
Okay, so if you were looking at a cat, what would FEK actually look like? What are the sort of telltale signs?
Well, there are a few pretty characteristic things. One common sign is what vets call paralimbal corneal vascularization.
Okay, fancy term. What's that mean?
It just means you see new blood vessels growing, starting around the edge of the cornea, where the clear part meets the white part.
Oh, okay. Little red lines creeping in.
Exactly. And then there's usually this white-pink stuff, an infiltrate, we call it. It's basically a collection of inflammatory cells and material building up on the cornea's surface.
Like a film or a patch?
Sort of, yeah.
Are they?
And often you'll see corneal edema, too, which is just swelling, makes the cornea look a bit cloudy or hazy.
Mm-hmm.
You might also hear it called proliferative keratitis. That just emphasizes that there's extra tissue building up.
Got it. And does it affect certain cats more than others, like age or breed?
The info points mostly towards young adult to middle-aged cats. They seem to be the most commonly affected group.
Okay. So for an owner, what might they actually notice day to day? What symptoms would they see?
Right. So it can show up in just one eye or sometimes both.
Okay.
And here's something quite interesting. Despite how it can look, cats with FEK often share very little, if any, eye pain, which is kind of surprising, isn't it?
Yeah, you'd think an eye condition like that would be really uncomfortable.
You would. But owners might notice maybe some discharge, could be watery, could be more mucus-like.
Mm.
And that blood vessel growth we talked about, it can cover just a small section of the cornea's edge, maybe 90 degrees, or it could go all the way around 360 degrees. Often starts on the temporal side or maybe the lower inner part.
Okay.
And then there's that white to pink material on the cornea itself. It can look flat, or sometimes it's a bit raised, maybe even looks a bit grainy.
Gritty, almost.
Yeah, sometimes you see these tiny white, almost gritty-looking spots scattered around too, plus the swelling, the edema we mentioned.
Right.
And sometimes there's an actual sore, an ulcer on the cornea, but not always. Oh, and lastly, the conjunctiva, that pink lining inside the eyelids and over the white part and the third eyelid, that little flap in the corner, they might look red and swollen, maybe thickened. Sometimes they even get a kind of bumpy look like cobblestones.
Wow. Okay. That paints a pretty clear picture. So what causes all this? Is it like an infection?
Well, this is where it gets really fascinating, actually, because the exact cause, the idiopathogenesis, the technical term for how it starts and develops, is actually unknown.
Really? So it's still a bit of a mystery.
It is, yeah, a bit of a puzzle. But there is one suspect that's been looked at quite a bit, feline herpesvirus 1. FHV1.
Oh, herpes. That's super common in cats, isn't it?
Yeah.
But I think the notes mention some disagreements about its role here.
Exactly. That's the tricky part. There was one study that found FHV1 in like 76% of the FEK samples they tested.
Wow, that sounds significant.
It does, but then another study found 0%. None at all.
Oh, that's confusing.
It really is. And it just shows how much we still don't fully understand about what triggers FEK.
Yeah.
Maybe FHV1 acts as a trigger in some cats, or maybe it makes things worse if it's already there, but its exact role, still pretty unclear.
So if it's not definitely the virus, what are the other theories? What's the thinking on what's actually happening immunologically?
Right. The main idea revolves around the immune system messing up somehow. Two main types of immune reactions are suspected.
Okay.
One is what's called a type I hypersensitivity. You can kind of think of it like an allergy.
Like hay fever, but in the eye.
Sort of, yeah. It involves antibodies called IgE and specific cells like mast cells, and crucially, those eosinophils we keep mentioning. They release chemicals that cause inflammation.
Okay, that's one idea. What's the other?
The other is a type 5U reaction. This involves different immune cells, T lymphocytes. The idea is they get activated, release a signal, something called IL-5, and that signal basically tells the eosinophils to go and cause damage right there in the cornea.
So either way, eosinophils seem to be the key troublemakers here.
They definitely seem to be the main effector cells, yes. The ones doing the direct damage.
And have things like bacteria or fungi been ruled out?
Yes, pretty thoroughly. Studies using cultures, looking at tissue slices, even powerful electron microscopes, they haven't consistently found bacteria or fungi as the primary cause.
It's good to know.
However, it is important to remember that if the cornea gets damaged, maybe with an ulcer, then bacteria can sometimes jump in and cause a secondary infection.
Right, an opportunistic infection.
Exactly.
So given all this, how does a vet figure out for sure that it is FEK and not something else that looks similar?
Yeah, that's diagnosis, and it's really key. They have to rule out other possibilities, what we call differential diagnoses.
Like what? What else could it be mistaken for?
Well, sometimes a cat might have a corneal ulcer that just won't heal and blood vessels grow in. That can look a bit similar, but usually lacks that classic white-pink infiltrate, that buildup. Then there's FHV1 stromal keratitis, another herpes-related eye issue. It can look similar too, but often it's less proliferative, less buildup, maybe more painful, and more likely to have ulcers.
Makes sense.
You also have to think about, though less common on the cornea itself, things like tumors. Lymphoma, for instance, often involves other parts of the eye, too, like the conjunctiva or inside the eye. Squamous cell carcinoma is another, but it's pretty rare on the cornea in cats.
Right.
And finally, some bacterial infections like chlamydia or mycoplasma, they mostly cause problems at the conjunctiva, that pink tissue, not so much the cornea itself.
Okay, so it's a process of elimination, partly. Are there specific tests that point directly to FEK?
Absolutely. While sometimes a regular blood count, a CBC, might show higher numbers of eosinophils in the body, generally that's not always the case.
So not definitive.
No. The really definitive first-line test is corneal cytology.
Cytology. Looking at cells.
Exactly. The vet gently collects some cells from the surface of the cornea, maybe with a special swab or a tiny scrape tool, and then looks at them under a microscope.
And what do they look for?
In FEK, you'll see lots and lots of eosinophils. That's the key finding. You might also see granules that have come out of those eosinophils, plus other inflammatory cells, mast cells, neutrophils, lymphocytes, plasma cells, along with the normal corneal cells.
And that confirms it.
It's highly suggestive, yes. And cytology also helps rule out those other infections, like chlamydia and mycoplasma.
What about testing for the herpesvirus, FHV1? You mentioned the conflicting studies, but do they test for it anyway?
They can using PCR tests, but the information suggests it's not that helpful for diagnosing FEK specifically.
Why not?
Because lots of healthy cats carry FHV1. So a positive test doesn't prove the virus is causing the keratitis. It might just be there coincidentally.
Ah, okay. Correlation isn't causation.
Precisely. There are other tests, like IFA for chlamydia if that's suspected. And of course, they'll always use a Fluorescein stain.
The green dye test.
That's the one, to check if there are any ulcers, any open sores on the cornea.
Okay. And what if it's a really tough case or it's not responding to treatment? Are there more invasive tests?
Yes, in those situations, or if the diagnosis is still murky, they might do a keratectomy.
Which is?
It's a minor surgical procedure where they remove a very thin superficial layer of the affected cornea. That tissue sample is then sent off for histopathology.
A biopsy, essentially.
Exactly. Looking at the tissue structure under the microscope, this can show very specific changes, confirming FEK, like thickening of the surface layers, those blood vessels, the characteristic inflammatory cells, especially eosinophils, deep within the tissue layers, gives a really detailed picture.
Right. So once you've got that diagnosis, confirmed hopefully by cytology, what's the plan? How is FEK treated?
Treatment is almost always medical, meaning using medications, and usually can be managed at home on an outpatient basis.
Okay. What kinds of medications are the mainstays?
There are several options. Topical cyclosporine A is used a lot. It's an eye drop.
How does that work?
It modulates the immune system locally in the eye. You usually start applying it maybe 2 or 3 times a day, then try to gradually reduce the frequency to the lowest effective dose. Sometimes you might even be able to stop it eventually.
And it's good for certain cases.
Yeah, it's often a good choice if you want to avoid other drugs like oral steroids or magistral acetate, maybe in a diabetic cat, Or if you suspect FHV1 is involved, as cyclosporine doesn't flare up herpes like steroids can.
Any downsides?
Some cats find it a bit irritating, might get some redness or swelling of the eyelids.
Okay. What about topical steroids, like prednisolone eye drops? They're common for inflammation, right?
They are, yes, and they're definitely used for FEK too. Things like prednisolone acetate or dexamethasone drops. Again, you'd typically start with more frequent application, maybe every 6 to 12 hours for a few days, and then taper down slowly.
And can they eventually stop those too?
Often, yes, but, and this is really important, but you have to be cautious with topical steroids if there's any chance FHV1 is lurking.
Because they can cause a flare-up.
Exactly. They can suppress the local immunity enough to let the herpes virus reactivate and cause problems. So careful monitoring is needed.
That's a crucial point. So if you do suspect herpes is involved, would you use antivirals?
Yes, that's often considered. Adding an antiviral medication, either as drops or maybe pills, might be beneficial alongside the other treatments if FHV1 is a known issue or strongly suspected.
Okay. What if giving eye drops multiple times a day is really difficult for an owner?
Yeah, that can be a challenge with some cats. In those tougher cases, the vet might consider injecting a long-acting corticosteroid like triamcinolone directly under the conjunctiva.
An injection in the eye tissue.
Under the lining, yes. It releases the steroid slowly over time, but it's usually reserved for cases that are hard to manage otherwise.
Gotcha. Are there any pills, any oral medications used?
Yes, there are. Midestrol acetate is an oral medication that can work quite well for FEK.
How's that given?
It's usually started daily for a short period, then maybe every other day, and then tapered down to the lowest dose that keeps things under control.
Sounds effective, but are there side effects?
Yes, and this is really important. Midestrol acetate can have some significant potential side effects. Things like suppressing the adrenal glands, causing diabetes, increasing appetite, leading to weight gain, behavior changes, mammary gland issues, and even a serious uterine infection called pyometra in unspayed females.
Wow, okay. So not without risks.
Definitely not. It's also generally avoided in cats with liver problems or other major health concerns. It needs very careful consideration and monitoring.
Are there other oral options, maybe oral steroids like prednisolone?
Yes, systemic prednisolone given as pills is another option. It might be used if a cat really won't tolerate eye drops, or if cyclosporine isn't working, or if midestrol acetate isn't appropriate because of the side effect risks. Again, you start with a higher dose and then taper down gradually as the eye improves.
It really sounds like managing FEK is a bit of a balancing act. You're trying to control the inflammation, but also watching out for side effects or flare-ups of other things like herpes.
That's a perfect way to put it. It absolutely is. The information really emphasizes how important close follow-up is, especially with topical steroids, because of that FHV1 risk. Owners need to know to call the vet right away if the eye seems to be getting worse.
Right.
And like we said, with midestrol acetate, the potential downsides are significant and have to be weighed carefully against the benefits for that specific cat.
So what's the long-term picture usually like for a cat with FEK? How long does treatment typically go on?
You know, often the response to starting treatment is quite good, pretty rapid. You see improvement relatively quickly.
That's encouraging.
It is. But getting the eye completely back to normal, resolving everything, that can take time, anywhere from days to sometimes even months.
Okay.
And unfortunately, the reality is that many cats need some kind of long-term therapy, maybe not daily, but ongoing medication at a low level to keep the FEK from flaring back up.
So it's often a chronic condition.
It often behaves like one, yes. The good news is that the actual changes on the cornea, the blood vessels, the infiltrate, they can often heal really well, sometimes with very little or even no scarring left behind.
Oh, that's great.
It is. But owners need to be prepared for recurrences. It's quite common for FEK to come back, either shortly after stopping treatment or even months or years later.
Right. Needs ongoing vigilance.
Definitely.
Okay, so let's just quickly recap our deep dive then. Feline Eosinophilic Keratitis, FEK, is basically an immune system issue hitting the cornea in young to middle-aged cats. You see specific signs like new blood vessels creeping in, that pinkish buildup on the surface. Diagnosis really hinges on cytology, looking at the cells.
That's the key test.
And while feline herpesvirus, FHV1, might be involved somehow, the exact trigger is still, well, a bit unknown.
Still a bit of a mystery, yeah.
Treatment uses various meds, often topical like cyclosporine or steroids, sometimes oral like midestrol acetate, but needs careful management because of side effects and that FHV1 link. And it's often a long-term management situation with a risk of recurrence.
You've got it. And what still fascinates me is that disconnect, you see these quite dramatic changes in the eye, yet the cat often doesn't seem hugely bothered by it pain-wise.
Yeah, that is odd.
It really tells you something about how unique this condition is. And, the whole question mark around the cause, especially the herpes connection, leaves a lot of interesting questions still open for research.
It really does, and it makes you think, doesn't it? If FEK is immune-mediated, potentially linked to a common virus, what other things, maybe things we don't even connect yet, could be influencing inflammatory diseases in our pets?
That's a good question.
It is. What does it tell us about just how complex their health really is?
Yeah.
Definitely some food for thought there. Thanks for digging into this with us today.